The question I'm going to answer in this video is, what about dementia care? If my parent or my spouse needs dementia care, is an adult family home a good choice for me? A few ways to answer that. The answer is most definitely yes, and you have to know what to look for. Okay? So in general, you might compare, well, we hear about all these dementia care units. Is that the better thing, or is an adult family home the better environment? Well, two things I see a lot, and a big problem with the large dementia care unit is that the environment in that unit has benefits and drawbacks, like most everything in life. The benefits are they are specifically designed for people who have advanced dementia. So you're going to be in an environment where it's designed for that. There is also the safety, because these are locked units, so a confused resident cannot just walk out of it and get lost. So these are some of the benefits, but the drawbacks are also there. One of them is people get more confused. Why is that? Because lights are on almost 24/7. That is very disorienting for people, especially if you have dementia and you're already disoriented. You have a constant parade of people coming in and out all the time. That adds to the confusion and to the stress level of a person with dementia. When I say stress level, what I mean is this. The brain is deteriorating to a point where it cannot process all the sensory stimuli that come into the brain and that come through the senses. So all this noise needs to be processed, all the visual cues, so this would be all the people, all the hallways, all the doors. Your brain needs to process all of that, and when it's lost its capacity and cannot do that job, it creates a lot of stress. So these are the drawbacks of being in a memory care unit. All right? That's why an adult family home would be a much better setting, because it's calmer. There is the same faces all the time in terms of caregivers. There is more silence. At night, the lights go off. So there is more of a natural rhythm, but what that amounts to in the end of it is that the brain has a little bit less information to process and the stress level goes down, so people do a little better. Now, the very important part about adult family homes and dementia specifically is that not all the adult family homes are very well suited for dementia care. So here's what I mean. If you have a patient, a resident who elopes a lot, meaning they are wanting to go home, okay? So they would be getting up at 2 in the morning and say, hey, I'm in the wrong place here, I need to go home, and they try to leave. You need to make sure that the home is actually set up to be able to handle those type of behaviors. That's one. And number two is whether the adult family home has a secured perimeter or not. What I mean by that is, if a resident may be able to get out the front door of the house in case there is a fire or whatever, but once they get past the front door, they cannot go onto the street because there's going to be a fence around the property itself. So we call that a secured perimeter. So if you have someone with advanced dementia but still ambulatory, who has a risk for elopement, that's a very important factor. All right? So care, secured perimeter, overnight care, in other words, 24/7 awake staff is very important. So if these elements are there and you're looking to place someone with dementia, chances are very high that you'll be very happy in an adult family home. If you enjoyed this information and you would like to receive 20 more free videos on the most frequently asked questions that people ask about adult family homes, and a copy of my ebook called Everything You Should Know About Adult Family Homes, please visit adultfamilyhomescentral.com/free.